41. Which action should the nurse take to promote effective teamwork in a multidisciplinary setting? A. Disregard the opinions of other team members to maintain authority. B. Clearly communicate patient care needs and encourage input from all team members. C. Avoid discussing concerns with the team to prevent conflicts. D. Focus only on the nurse's role and avoid sharing information with other team members. Answer. B. Clearly communicate patient care needs and encourage input from all team members. Rationale. Effective teamwork relies on clear communication and collaboration. Encouraging input from all team members ensures a holistic approach to patient care. 42. What is the primary goal of patient-centered care? A. To focus solely on the physician's orders for treatment. B. To consider the patient's preferences, values, and needs in the care plan. C. To ensure that all care decisions are made by the nurse. D. To prioritize the efficiency of healthcare delivery over patient needs. Answer. B. To consider the patient's preferences, values, and needs in the care plan. Rationale. Patient-centered care involves understanding and respecting the individual patient's preferences, values, and needs to deliver the best care. 43. When assigning a task to an unlicensed assistive personnel, UAP, the nurse should ensure A. The task is within the UAP's scope of practice. B. The UAP has no prior experience with the task. C. The task is non-essential and can be done later. D. The UAP completes the task without direct supervision. Answer. A. The task is within the UAP's scope of practice. Rationale. Delegation must be based on the task's appropriateness and the UAP's qualifications. Assigning tasks outside the UAP's scope can lead to errors or safety issues. 44. A nurse is assigned to care for a patient in the emergency department. Which of the following actions demonstrates appropriate time management? A. Prioritize tasks based on the severity of the patient's condition. B. Complete tasks for stable patients before addressing critical patients. C. Focus on one patient at a time, avoiding multitasking. D. Complete all paperwork before addressing patient care. Answer. A. Prioritize tasks based on the severity of the patient's condition. Rationale. In an emergency setting, tasks should be prioritized according to the patient's critical needs to ensure timely and appropriate care. 45. A nurse is caring for a patient who is refusing treatment. What should the nurse do first? A. Inform the patient of the consequences of refusal. B. Respect the patient's decision without further discussion. C. Explore the reasons for the refusal and provide education about the treatment. D. Seek approval from the physician before proceeding. Answer. C. Explore the reasons for the refusal and provide education about the treatment. Rationale. It is important for the nurse to understand the patient's reasons for refusal and provide necessary education to help the patient make an informed decision. 46. When managing a patient's care plan, what is the nurse's primary responsibility? A. To follow the physician's orders without modifications. B. To adjust the plan of care based on the patient's progress and needs. C. To ensure the patient does not question the prescribed care. D. To complete tasks as quickly as possible to focus on other patients. Answer. B. To adjust the plan of care based on the patient's progress and needs. Rationale. The nurse's responsibility is to ensure the care plan is dynamic and adjusted according to the patient's ongoing needs and response to treatment. 47. How should a nurse manage care when dealing with a high number of patients on a busy unit? A. Focus on the most critical patients and delegate tasks for others. B. Prioritize tasks based on patient acuity and needs and delegate appropriately. C. Complete all tasks at once without prioritizing. D. Wait for the physician to prioritize care for the nurse. Answer. B. Prioritize tasks based on patient acuity and needs and delegate appropriately. Rationale. Nurses should prioritize patient care based on acuity and delegate tasks to appropriate team members to ensure timely and effective care. 48. What is the nurse's role when dealing with conflicts in a healthcare team? A. Ignore the conflict and continue with patient care. B. Seek to understand all perspectives and mediate the situation. C. Always side with the most senior team member. D. Allow the conflict to escalate to gain clarity on the issue. Answer. B. Seek to understand all perspectives and mediate the situation. Rationale. Nurses should actively address conflicts by listening to all sides and working to resolve issues constructively to promote teamwork and patient safety. 49. What is the first step in patient advocacy when a patient refuses treatment? A. Consult with the physician to persuade the patient to accept the treatment. B. Listen to the patient's concerns and provide information to clarify misunderstandings. C. Respect the patient's decision without further conversation. D. Complete the necessary documentation of the refusal without discussion. Answer. B. Listen to the patient's concerns and provide information to clarify misunderstandings. Rationale. Patient advocacy involves listening to the patient's concerns and providing clear, balanced information to help them make an informed decision. 50. What should a nurse do if a patient's family requests confidential information about the patient's condition? A. Disclose the information as requested, with patient permission. B. Provide the information without patient consent for family's peace of mind. C. Refuse to share any information without consulting the healthcare team. D. Tell the family that the patient's information is confidential and cannot be shared. Answer. A. Disclose the information as requested, with patient permission. Rationale. Confidentiality must be maintained unless the patient consents to share information. Nurses must ensure patient privacy is respected and involve the patient in the decision to disclose details. 51. What is the nurse's responsibility in managing care for a patient with a complex condition? A. Follow standard protocols without adapting to the patient's specific needs. B. Collaborate with the healthcare team to create an individualized care plan. C. Focus only on one aspect of the patient's care to ensure quality. D. Limit communication with the healthcare team to avoid overwhelming them. Answer. B. Collaborate with the healthcare team to create an individualized care plan. Rationale. Nurses must collaborate with the healthcare team to provide comprehensive, patient-centered care tailored to the individual's specific needs. 52. What is an essential aspect of time management when caring for multiple patients? A. Complete the simplest tasks first to feel productive. B. Delegate all tasks to other staff members. C. Prioritize patient care tasks based on urgency and importance. D. Wait for the patients to request care before acting. Answer. C. Prioritize patient care tasks based on urgency and importance. Rationale. Time management requires prioritizing tasks to address the most urgent patient needs and ensuring optimal care delivery. 53. What should the nurse do if a patient expresses dissatisfaction with the care provided? A. Ignore the complaint and continue with care. B. Listen to the patient's concerns and attempt to resolve the issue. C. Inform the physician that the patient is unhappy with care. D. Tell the patient that their concerns are unfounded and focus on the plan. Answer. B. Listen to the patient's concerns and attempt to resolve the issue. Rationale. Patient satisfaction is important, and addressing concerns through listening and problem-solving helps improve the care experience. 54. When should a nurse involve social services in the care of a patient? A. Only when the patient requests assistance from social services. B. If the patient is unable to manage their care independently or has social or financial needs. C. When the healthcare team cannot communicate effectively with the patient. D. Only if the patient has a history of noncompliance with treatment. Answer. B. If the patient is unable to manage their care independently or has social or financial needs. Rationale. Social services are often involved when a patient requires assistance with non-medical aspects of care, such as financial or social support. 55. What is the nurse's role when a patient has a do not resuscitate (DNR) order? A. Ignore the DNR order and proceed with life-saving interventions. B. Follow the DNR order and ensure that it is respected by all team members. C. Advocate for the patient to have the DNR order changed. D. Delay action on the DNR order until the physician is available. Answer. B. Follow the DNR order and ensure that it is respected by all team members. Rationale. The nurse must ensure that the patient's wishes, as indicated by the DNR order, are respected. 56. What is the nurse's responsibility when a patient requests to leave the hospital against medical advice, AMA? A. Allow the patient to leave without informing the healthcare team. B. Discuss the risks of leaving AMA and document the patient's decision. C. Inform the physician but let the patient leave regardless. D. Call security to prevent the patient from leaving. Answer. B. Discuss the risks of leaving AMA and document the patient's decision. Rationale. It is important to inform the patient of the risks of leaving AMA and to document their decision for legal and safety purposes. 57. How can a nurse demonstrate leadership when supervising a team of nurses? A. Micromanage tasks to ensure everything is done correctly. B. Empower team members by providing guidance and fostering teamwork. C. Limit communication with the team to avoid confusion. D. Focus only on managing tasks and avoid engaging with the team. Answer. B. Empower team members by providing guidance and fostering teamwork. Rationale. Effective leadership involves motivating and guiding the team, encouraging collaboration, and empowering nurses to use their skills. 58. What is the nurse's role in managing a patient's pain? A. Administer pain medication according to the prescribed schedule. B. Focus only on pharmacological interventions for pain relief. C. Use a combination of pharmacological and non-pharmacological interventions. D. Disregard the patient's pain complaints if they are not critical. Answer. C. Use a combination of pharmacological and non-pharmacological interventions. Rationale. Managing pain effectively requires a holistic approach, including both medication and complementary therapies to enhance comfort and well-being. 59. What is the best strategy for a nurse to handle ethical dilemmas in patient care? A. Make decisions based on personal values. B. Consult with the healthcare team and consider patient autonomy. C. Avoid addressing ethical concerns to prevent conflicts. D. Follow hospital policies without considering ethical issues. Answer. B. Consult with the healthcare team and consider patient autonomy. Rationale. Ethical dilemmas should be addressed through team discussions, respecting patient autonomy, and considering all perspectives before making decisions. 60. How should a nurse handle a situation where a patient is unable to pay for their treatment? A. Ignore the financial issue and proceed with care as usual. B. Provide information about available financial assistance or social services. C. Request that the patient pay up front before receiving care. D. Cancel the treatment until the patient can pay. Answer. B. Provide information about available financial assistance or social services. Rationale. Nurses should help patients access resources to support financial needs, ensuring that care is not withheld due to financial barriers. 61. When supervising a nursing student, the nurse should A. Allow the student to perform tasks independently without supervision. B. Provide guidance and ensure the student's actions are safe and appropriate. C. Ignore mistakes made by the student and continue with the day. D. Assign the student tasks that are beyond their current capabilities. Answer. B. Provide guidance and ensure the student's actions are safe and appropriate. Rationale. Supervising a nursing student involves ensuring their actions are safe, providing guidance, and helping them build their skills. 62. What should a nurse do if a patient's care needs change suddenly? A. Continue with the original care plan to avoid disruption. B. Inform the healthcare team and modify the care plan accordingly. C. Avoid updating the care plan until the physician is available. D. Delegate the changes to unlicensed assistive personnel. Answer. B. Inform the healthcare team and modify the care plan accordingly. Rationale. Sudden changes in a patient's condition require the nurse to reassess the care plan and collaborate with a healthcare team to update it. 63. What should the nurse do if a colleague is demonstrating unsafe practice? A. Ignore the behavior to avoid confrontation. B. Report the behavior according to the facility's policies and procedures. C. Confront the colleague privately without reporting the behavior. D. Wait until the next shift to address the concern. Answer. B. report the behavior according to the facility's policies and procedures. Rationale: reporting unsafe practice is essential to ensure patient safety and follow ethical and legal responsibilities. 64. A nurse is caring for a patient with a terminal illness who expresses a desire for assisted suicide. The nurse should A. Immediately report the request to the physician for legal guidance. B. Respect the patient's decision and proceed with euthanasia. C. Listen to the patient's concerns, provide emotional support, and inform them of available resources. D. Ignore the request as assisted suicide is illegal. Answer: C. Listen to the patient's concerns, provide emotional support, and inform them of available resources. Rationale: nurses should listen to the patient's concerns, offer emotional support, and explore other options like palliative care and counseling. 65. When delegating a task to an unlicensed assistive personnel, UAP, the nurse should consider A. The UAP's previous work experience with a task. B. Whether the task is critical or invasive in nature. C. The nurse's ability to complete the task on time. D. The level of supervision required for the task. Answer: B. Whether the task is critical or invasive in nature. Rationale: delegating tasks requires considering the level of risk associated with the task, ensuring it is within the UAP scope of practice. 66. What should the nurse do when a patient expresses fear of a surgical procedure? A. Ignore the patient's fear and proceed with the plan. B. Reassure the patient without providing further details. C. Provide information about the procedure and answer the patient's questions. D. Tell the patient to be brave and avoid discussing their fear. Answer: C. Provide information about the procedure and answer the patient's questions. Rationale: addressing patient concerns with information helps alleviate anxiety and empowers the patient to make informed decisions. 67. When managing a patient's care during a disaster situation, the nurse should A. Prioritize care based on the severity of the patient's condition. B. Focus only on patients with immediate life-threatening injuries. C. Evacuate all patients to a safe location, regardless of their condition. D. Ignore triage protocols to speed up the process. Answer: A. Prioritize care based on the severity of the patient's condition. Rationale: in disaster situations, the nurse must prioritize care based on the severity of injuries or conditions, following established triage protocols. 68. How can the nurse promote cultural competence when providing care to diverse patients? A. Use one standard approach for all patients regardless of cultural background. B. Be aware of and respect cultural differences, incorporating them into care plans. C. Avoid discussing cultural preferences to prevent discomfort. D. Assume that all patients share the same cultural practices. Answer: B. Be aware of and respect cultural differences, incorporating them into care plans. Rationale: cultural competence involves recognizing and respecting cultural differences, which improves the quality of care and patient outcomes. 69. What should a nurse do if a patient refuses to take prescribed medication? A. Ignore the refusal and proceed with the medication administration. B. Respect the patient's decision and document the refusal. C. Persuade the patient to take the medication by discussing its benefits. D. Report the refusal to the physician without discussing it with the patient. Answer: B. Respect the patient's decision and document the refusal. Rationale: the nurse must respect the patient's autonomy, document the refusal, and discuss the decision with a healthcare team. 70. What is the nurse's responsibility in ensuring the safe administration of medication? A. Ensure the patient is aware of the medication's side effects before administration. B. Administer the medication without verifying the patient's identity. C. Follow the 5 rights of medication administration: right patient, right drug, right dose, right route, right time. D. Allow the patient to choose the time of administration if they request it. Answer: C. Follow the 5 rights of medication administration: right patient, right drug, right dose, right route, right time. Rationale: ensuring safe medication administration involves following the 5 rights to minimize the risk of errors. 71. A nurse is managing care for a patient who has a DNR, do not resuscitate, order. What is the nurse's role in this situation? A. Administer life-saving measures as needed, regardless of the DNR order. B. Respect the DNR order and ensure all healthcare team members are aware. C. Ask the patient's family to make decisions about resuscitation. D. Ignore the DNR order if the patient's condition improves. Answer. B. Respect the DNR order and ensure all healthcare team members are aware. Rationale. The nurse must respect the patient's wishes as outlined in the DNR order, ensuring the entire healthcare team is informed. 72. How should a nurse respond to a patient who is exhibiting signs of noncompliance with treatment? A. Ignore the issue, as the patient's decision is final. B. Discuss the reasons for noncompliance and explore possible solutions. C. Force the patient to comply with a treatment plan. D. Report the patient to the physician without engaging in a conversation. Answer. B. Discuss the reasons for noncompliance and explore possible solutions. Rationale. Open communication with the patient is key to understanding barriers to compliance and finding solutions together. 73. In a critical care setting, what is the most important priority for a nurse when managing patient care? A. Provide comfort measures for all patients. B. Address the immediate life-threatening concerns first. C. Ensure that routine tasks are completed on time. D. Focus on the emotional needs of the patient first. Answer. B. Address the immediate life-threatening concerns first. Rationale. In critical care, priority must be given to addressing life-threatening issues to stabilize the patient. 74. What should a nurse do when providing care to a patient with a language barrier? A. Ignore the language barrier and proceed with care. B. Use a family member as a translator without checking for confidentiality concerns. C. Utilize a professional interpreter to ensure clear communication. D. Assume the patient understands based on nonverbal cues. Answer. C. Utilize a professional interpreter to ensure clear communication. Rationale. Using a professional interpreter ensures accurate communication while maintaining confidentiality and patient safety. 75. A nurse is preparing to discharge a patient. Which action is the nurse's priority before discharge? A. Provide the patient with a list of medications to be taken. B. Ensure that the patient understands the care instructions and has appropriate follow-up care. C. Complete the discharge paperwork without discussing care instructions. D. Advise the patient to contact the physician if any issues arise. Answer. B. Ensure that the patient understands the care instructions and has appropriate follow-up care. Rationale. Ensuring that the patient understands care instructions and follow-up plans is essential for successful discharge and recovery. 76. What is the best way for a nurse to handle a situation where there is a lack of resources for patient care? A. Proceed with care despite the lack of resources. B. Prioritize care based on patient acuity and seek support from management. C. Ignore the lack of resources and continue with the usual plan. D. Distribute resources equally to all patients, regardless of need. Answer. B. Prioritize care based on patient acuity and seek support from management. Rationale. In resource-limited situations, it is important to prioritize care and communicate with management to ensure resources are allocated appropriately. 77. How should a nurse handle a situation where a patient is exhibiting signs of distress or anxiety before a procedure? A. Ignore the patient's distress and proceed with the procedure. B. Reassure the patient, explain the procedure, and provide emotional support. C. Ask the patient to wait in the waiting room until they feel better. D. Proceed with the procedure quickly to reduce the patient's anxiety. Answer. B. Reassure the patient, explain the procedure, and provide emotional support. Rationale. Providing information, reassurance, and emotional support can help alleviate anxiety and prepare the patient for the procedure. 78. What is the nurse's role in ensuring informed consent is obtained from a patient? A. The nurse obtains informed consent by providing all necessary information. B. The nurse witnesses the signature and ensures the patient understands the procedure. C. The nurse is responsible for explaining the procedure and obtaining the signature. D. The nurse is not responsible for informed consent and should refer the patient to the physician. Answer. B. The nurse witnesses the signature and ensures the patient understands the procedure. Rationale. The nurse's role is to witness the signature and ensure that the patient fully understands the procedure and the risks involved. 79. How can a nurse promote the effective use of resources in a healthcare setting? A. By using resources inefficiently to ensure patient satisfaction. B. By conserving resources when possible while maintaining quality care. C. By prioritizing speed over quality to reduce resource usage. D. By not considering the cost of care in decision-making. Answer. B. By conserving resources when possible while maintaining quality care. Rationale. Efficient use of resources balances quality care with the need for cost-effective decision-making. 80. When caring for a patient who is experiencing a mental health crisis, the nurse should A. Focus only on the medical needs of the patient. B. Involve the patient's family in the decision-making process. C. Provide emotional support, ensure safety, and involve appropriate mental health professionals. D. Ignore the patient's emotional state to focus on physical needs. Answer. C. Provide emotional support, ensure safety, and involve appropriate mental health professionals. Rationale. A holistic approach is essential when caring for patients in mental health crises, ensuring both emotional support and safety.